Hello everyone, this is Dr. Mansi from Homeopathy 360 and I'm very happy to be back again on another day with another session with one and only Dr. Nimesh Shukla sir. A very warm welcome to you. So Dr. Nimesh Shukla sir is a highly experienced homeopathic physician with over 42 years of teaching and practice in the field. He holds LCEH and MD Homeopathy in Materia Medica and serves as the head of department and professor in medicine at CMP HMC College with more than 42 years of experience in practice and teaching. Dr. Shukla has also been examiner for UG and PG students across various universities and a PG guide for Mumbai University and MUHS. He is a renowned speaker in many seminars and webinars, and his educational content on Instagram has gained significant traction. And we love the way how Dr. Shukla sir teaches Materia Medica, and we are really very inspired by him. And today we are going to learn a lot in Materia Medica, and we are having a very important and very trending webinar topic, that is winter wellness, homeopathy for cold weather illness. So very warm welcome to you, sir.
Thank you, Dr. Mansi. Before I start my webinar,
Yes, sir.
I would like to share one thing. You all must be heard the name of famous cricket coach, Achrekar sir,
Yes, sir.
who gave Sachin Tendulkar. So I also like a coach Achrekar sir, but I want my each and every student should become Sachin Tendulkar of homeopathy.
We are very glad, sir.
Therefore, I always say homeopathy is not a rocket science because it's based on a nature's law of cure.
Yes, sir.
And nature is always simple. So I made homeopathy simplified. Many a time what happened, होम्योपैथी दिल में रहती है, समझ में नहीं आती. But I assure you, after my webinar, होम्योपैथी दिल में भी रहेगी, समझ में भी आएगी और रिजल्ट भी लाएगी. So let's start with the webinar, Winter Wellness.
Yes.
As you all know, in winter, weather become very, very dry. The humidity become very, very less. And because of this dry weather, there are many respiratory problems. Normally in winter, there are respiratory problem, skin problem, neuralgias, joint pain. Today I will try to cover all these four systems with some common drug and how to differentiate in the practice. We'll start with the respiratory. Now, as the weather become dry, the dust particles and the pollution become free. Patient starts suffering from upper respiratory, sore throat, low respiratory, and also there are winter viruses which can cause fever. Now, the important remedy for the coryza, which I had seen best result in my practice, is Rumex. Normally, we make mistake. Instead of giving Rumex, we give arsenical. But in winter, Rumex works much, much better than the arsenic. Arsenic is a drug for damp weather, wet weather. It works better there. Now, what are the symptoms of Rumex in coryza? There is a thin, watery discharge from the nose. Patient is very, very sensitive to cold air. He is so sensitive to cold air that he always wants to keep something in front of the nose so that he can prevent that cold air. Now, Rumex, there is a lot of irritation in the nose, thin, watery, acrid discharge, sneezing, and also there is a tickling sensation in the throat. There's a tickling sensation in the throat which is causing cough. There's a dry, irritating cough with tickling sensation in the throat. And throat is also sensitive to cold. Nose is also very, very sensitive to cold. Now, very important from practice point of view, when patient comes to you, either he comes when the cold had started, or he will come maybe after 2 or 3 days. Now, when it comes after 2 or 3 days, when the cold is already there, cough had started, throat is bad, he had developed some feverish feeling or fever. Maybe low grade fever, fever around 100, 100.5. That time, at that stage, instead of Rumex, you have to give Ferrum Phos 1 mg. Your potency is important. You have to give few doses of Ferrum Phos 1 mg. The symptoms are like Rumex. But now that state of coryza bhi hai, khansi bhi hai, and now bukhar aa gaya. So don't start with Rumex. Start with Ferrum Phos, or you are treating the patient with Rumex and patient develop fever. You have to follow Rumex with Ferrum Phos. It gives great, great result. Another drug, another characteristic of Rumex cough, in Rumex cough is associated with pain in clavicle and also diarrhea. Now, if you get pain in clavicle, it's a very peculiar symptoms. When I read these symptoms as a student, I was thinking how it is possible. But when I started my practice, I saw some patient, 2 or 3 patients who had similar symptoms. But very important, when patient is telling you pain in clavicle, you examine the clavicle. अगर clavicle में कुछ fracture वगैरह होएगा तो pain होएगा तो you can't take these symptoms. The examination is very important. Now, another drug which is very useful in winter cold, as everyone must be used, aconite. In aconite, the causation is exposure to dry cold wind, northwest wind. The most important symptom of aconite is sudden and violent onset, which is not there in Rumex. Till afternoon, nothing, but evening, little exposure to cold, little exposure to draft of cold air, and they develop severe cold. Sudden and violent onset. There is a dry coryza. There is hardly anything is coming out. There is a dry coryza with dryness of mouth, with increased thirst, and thirst for unquenchable thirst for cold water. Also, aconite is a great remedy for croupy cough. If you read the Nash, he had mentioned the trio of croupy cough in which aconite is there. Aconite, spongia, and hippar Aconite not only coryza, dry coryza, also the cough, croupy cough, which is aggravated in the evening or before midnight. Though patient is sensitive to draft of cold air, better in open air, and mentally patient having lots and lots of anxiety. Hypochondriac patient. He will come and tell you, Dr. Saab, now I am having cold, cough started. 100% I am going to get pneumonia, then double pneumonia, and then I am going to die. Lot of anxiety and hypochondriac nature of aconite, which is very important. But from practical point of view, all these sometimes you don't get. But two things is very important: sudden and violent onset, dry coryza, and exposure to dry cold wind with dryness and increased thirst. Now here in Rumex, there is no fever. In aconite, even they develop fever with the coryza. In Rumex, if the fever comes, you have to give ferrum force. Here, aconite by itself can control the fever, especially after it happened after coryza. Now, next drug, which is also very useful drug, is Dalkamara. Now, as everyone knows, Dalkamara for the damp weather, correct? But Dalkamara also a winter remedy, especially when there is a sudden drop of temperature. There are certain country like European country or on a hill station. During winter, there is also raining. And when it is not pouring, it's just a drizzling, just a drizzling. But when the drizzling starts, the temperature drops. Temperature drops drastically. And when patient is exposed to such change of temperature, you can think of Darkavara. The characteristic symptoms of Darkamara: there is a nose block from cold rain. I'm repeating again. Nose block from cold rain. In Matra Medica, every word is very, very important to differentiate. Now, here I am repeated cold rain causing nose block. There is one drug, lambda minor. There is one drug, lambda minor. Lambda minor also having nose block, but nose block because of aggravated because of heavy rain. In Dalkamara, cold rain. In Lemna minor, heavy rain. Another drug which normally we never think of it is phosphorus. Now, phosphorus also having similar symptoms, but intensity of rain is not only heavy, but with lot of thunder, lot of stormy weather, with lot of rain, heavy rain. In phosphorus, you may see some epistaxis, some blood also, with hoarseness of voice. Now come to Dalkamara. Now, if you want to differentiate Dalkamara and Lambda minor, you have to examine the throat. You have to examine the nose. Now, what happened in Lambda minor? You can see the polyp, nasal polyp. And because of this nasal polyp, which aggravated in heavy rain, become bigger in heavy rain, therefore there is a nose block. While in Dalkamara, there is a stuffy nose. In Dalkamara, there is a stuffy nose. And there is a thick yellowish discharge, which is already stuffed inside the nose. Patient is very, very sensitive to cold air. Therefore, like Rumex, Dalkamara patient also wants to keep his nose warm. But there is a difference between Rumex and Dalkamara. Now, these are all finer tuning. The same way when the cricket coach try to teach you, like, your stance should be little change and it can make the lot of difference. Similarly, in homeopathy, which I'm going to teach you, a fine tuning. Now, what happened in Rumex? Patient is sensitive to cold air, therefore he will keep his hand on the nose. While Dalkamara patient is very, very sensitive to cold air. He will take his handkerchief, make it warm, and he will keep it on the nose. He will keep it on the nose to make the nose warm. In Rumex, he wants to prevent that cold air which comes to the nose. While here, Dalkamara, not only preventing the cold air, but also wants to make the nose warm by keeping the handkerchief. Or if handkerchief is not there, what he will do? He will rub his palms like this and he will put it on the nose. He wants to keep his nose warm. This is Dalkamara. Understood? Very simple. If Dalkamara keeps his nose warm, he feels better. Now, another drug which comes close to Dulcamara. If you read that drug, in that drug also they mention aggravation from change of temperature. Like Dulcamara also, change of temperature is one of the most important symptoms. In that drug also, aggravation from change of temperature. That drug is Sticta. Sticta. In Sticta, there's a dry cold, dry coryza. There's a lot of dryness in the nose. While Dulcamara, there is a discharge, thick yellowish discharge. There's a dryness in the nose, dry coryza, pain in the root of the nose, pain in the root of the nose. Now here, I forgot to tell you, in aconite also there is a pain in the root of the nose and dry coryza is also there. Now the Sticta comes very close to aconite and Dulcamara. Now how do you differentiate all three drugs? Now what happened in Sticta is a dry coryza with constant wet filling in the nose. With dry coryza, there is a constant wet filling in the nose. There's a nose block also and always wants to blow the nose. Because of that wet filling, he wants to blow the nose. But nothing comes out. He wants to blow the nose, but nothing comes out from the nose. While in Dulcamara, there's a nose block and thick yellowish discharge. Now, what happened in aconite? In aconite, there's a pain in the root of the nose, dry coryza, but there is no wet filling like Sticta. Aconite patient will not blow the nose. Sticta patient always wants to blow the nose because of that constant wet filling. And like Dulcamara, Sticta also aggravation from change of temperature, aggravation cold air. Now these are the coryza. But when sometime patient also suffer from sinusitis, sinusitis. A common prescriber will always make one mistake. Whenever sinusitis comes with thick yellowish discharge, sticky discharge, we always think of only one drug, mainly Kali bichrome. Yes, Kali bichrome is a great, great remedy for sinusitis with thick, sticky, stringy discharge, thick, yellowish, sticky, stringy discharge with a lot of PND. But it works better in summer if the weather is warm and patient develops sinusitis, then the Kali bichrome is the drug. While Hydrastis canadensis is for winter sinusitis. For winter sinusitis. Another important symptoms of Hydrastis in sinusitis, there is lots of pain in the nose and in the sinuses. Very painful sinusitis in the winter. Why pain is there in Hydrastis? As you know, Hydrastis is a great, great remedy, though it is from the plant kingdom. But it is one of the great remedy for cancer and cancer pain, especially CA stomach. Therefore, In hydrostatic candidiasis, there is a sinusitis, winter sinusitis with thick yellowish sticky discharge, like Kalibai only. If there's a winter is there, don't think of Kalibai. Give hydrostatic candidiasis 30 repeatedly, and you can see miraculous result. रिजल्ट आया तो दुआ में याद रखना. And natrum sulf is the drug for sinusitis in monsoon or rainy weather. Lot of pain with thick yellowish discharge. There is one rare drug, a very small drug, also very useful for coryza in winter. Saponaria. Saponaria. And saponaria is used when initial stage of the cold, when the cold has just started, and patient comes to you. Give saponaria 30, and it has a property, or it can break, it can prevent the further progression of cold. Now these are now another drug. Now what happened? As I told you, the weather become very, very dry. There are dust particles which become free. So those people who are allergic to dust, their respiratory problem increases. I had seen very good result, especially coryza from dust, sneezing from dust, is from pothos. From pothos. Though in the book it is mentioned, pothos is very good drug for asthma from dust. But I use even for coryza, even for cough. It gives very good result. Now in pothos, there is a thin watery discharge with lot of sneezing. Lot of sneezing. Another drug which has dust aggravation is bromium. But the difference between bromium and pothos, in bromium, summer aggravation, when the weather is very, very hot. And the weather is very, very hot. There is one more drug, solanum lycopus, also dust aggravation, coryza from dust or sneezing from dust. And one unusual drug, which is a dust allergy, lycinum or hydrophobinum. Lycinum or hydrophobinum. Now next, now these are the important drugs for the coryza. Now the sore throat, which is also very common during winter. Normally, the first drug which comes in your mind is Hipar sulf. Yes, you're right. Hepar sulf is a great, great remedy for sore throat or a tonsillitis, especially in winter, especially when they're exposed to slightest cold air. Very, very sensitive. But today, I will teach you one more drug, which is very, very, very useful in practice and which is very close to Hepar sulf. Now, what happens in Hepar sulf? There is a pus, there's a follicular tonsillitis, mainly on the right side. In the pain, there's a splinter-like pain. There is a splinter-like pain, especially while swallowing, and the pain radiates to the ear. Patient is so sensitive to cold air that he wants to close each and every windows of his house. Very, very chilly patient. Better by warm drink. Better by warm drink. Another drug which comes very close to Hepar sulf, which normally we never think of it, is cistus. CIS, cistus. Cistus patient also very, very sensitive to cold air. Like Hepar only. Like Hepar only. In cistus, not only patient is sensitive to cold air, but also inside the throat, there is a sensation of coldness. While in Hepar sulf, there is a splinter-like pain. While in cistus, there is a sensation of coldness in the throat. Now, practical problem, many times patients don't describe it correctly. Then how to ask this question? Very simple. Now, what is this sensation of coldness? If you want to develop artificially this sensation, very take halls or anything with menthol and you drink water, you will get sensation of coldness in the throat. Now, this similar type of sensation will get it in cistus. Another thing which is very important, which differentiates cistus and Hepar sulf, when you examine the patient, the throat of Hepar sulf, you can see the tonsils are first point, these are follicular tonsils. But when you examine the cervical region, you will not find many glands. Little bit, some lymph glands will be enlarged. But in cistus, lot of glands, cervical glands, lymphatic glands are inflamed. Therefore, multiple lymphatic glands here in the throat. Of course, if it is very little bit of chronic, you have to rule out tuberculosis. But it happened with the sore throat, with multiple glands which are very soft and not much painful. Give cistus. Now in cistus, this coldness is not limited to throat. Even the nose become very, very cold. Even the stomach is become very, very cold. Everywhere there is a coldness. Everywhere there is a coldness. There is a cold wave. Like in lechesis, there's a hot flushes, correct? In cystus, there are cold waves. Now, when patient is describing this cold wave, after rule out any infection in the body, anemic condition, because anemia patient also having a lot of chilliness, iron deficiency anemia especially. If everything is fine and still patient is having this coldness everywhere, cystus is the great remedy. Another drug come very, very close to cystus in this cold sensation is haloderma. In haloderma also there is a cold wave. Sometimes patient comes and tell you, हमारे शरीर में ठंड घुस गई ऐसा लगता है, हमारे शरीर में ठंड घुस गई है. You can think of cystus or haloderma. Haloderma is all over the body coldness. In cystus there are a lot of throat symptoms. In cystus there's a craving for cheese. Therefore, very close to HEPA is cystus. But a difference in HEPA, there is a splinter-like pain, while cystus, there is a coldness. Now, another drug for coldness in the throat while is Corellium rubrum. Now, Corellium rubrum not having much of throat symptom, but there is a lot of cough. There is a coryza and there is a post-nasal drip. Now, this post-nasal drip causing lot of irritation in the throat, followed by minute gun cough. And there is a coldness in the throat, like cystus. Like cystus, Corellum rubrum also. Like cystus, Corellum rubrum also. Patient is sensitive to cold air. Like HEPA, like cystus, even Corellum rubrum also similar symptoms. But if you examine the patient, if you see the throat, in HEPA, we will see the pus. In cystus, we will see the inflammation. While Corellum rubrum, we will see the post-nasal drip, which causing irritation and give rise to minute gun cough like this. And he wants to clear his throat. This is a characteristic of Corellum rubrum cough. He wants to clear his throat because there is a post-nasal drip which comes there and he wants to clear his throat. Therefore, with minute gun cough, he wants to clear his throat. This is very, very important symptoms for prescribing Corellum rubrum. You may not get that sensation of coldness. Forget it. You get PND in winter where the patient is sensitive to cold and always wants to clear his throat. Another drug comes very close to Corellum rubrum for clearing the throat is Argentum metallicum. But in Argentum metallicum, there is a vocal cord, laryngitis. And in the vocal cord, there is an inflammation and there is some secretion. And when patient is talking and the vocal cord opens up, there is a mucus thread here. here between the two vocal cord. And because of that, there is a voice is not clear. Therefore, to clear the voice, he will clear the throat. In argentum metallicum, there is no post-nasal tree. But cororum rubrum, there is a post-nasal tree. Now, for the winter cough, I said cororum rubrum, great remedy, which normally you never think of it. Another great remedy for winter cough, of course, Hiparsal and Spongia. Now, as I told you in Econite, before midnight, in Spongia, there's a dry cough, absolutely dry. This type of cough in Spongia, absolutely dry cough. In the book, it is described as if saw is driven through a pine ball. In practice, if you find any child, who's having a who's coughing like an adult, who's coughing like an adult, think of Spongia. Cough aggravation, lying down, cough from eating sweets. Now I'll tell you some clinical tips of Spongia. See, eating sweets, matlab, if they are eating that homemade sweets like shira, halwa, they may not get cough. It is not the sweets. When these sweets are, they added artificial color. When in the sweet, the artificial colors are there, and Spongia patient is very, very, very sensitive to all food colors. In winter, we are having habit of eating jalebi, hot jalebi with full of sugar syrup. Many times in the jalebi, to give that yellow color, they put food colors. Now that precipitate the cough in Spongia. After midnight, there is aggravations, lying down aggravation, cold drink aggravation, artificial color aggravation. Better by warm drink, better by warm food. Now, if you see the repertory, canned repertory, cough from sugar, Spongia is not there. Now, jalebi is a sugar, no? That basically in jalebi, that chasni is there, no? Sugar syrup. If the cough is because of sugar syrup or excessive sugar, we always think of one drug, argentum nitricum. Wrong. In argentum nitricum, sugar and sweet causing diarrhea, GI tract problem, not the respiratory problem. If you see the canned repertory, cough from sugar is only one drug, that is zinc metallicum. Zinc metallicum. याद रखना. Don't make mistake of giving argentum nitricum. Now, Spongia also having a barking cough. Now, barking cough means not a dog bite, bark. We make a mistake. Go to the Google and see what is barking cough. It is a barking of a seal. It's one of the sea animal. एक sea animal, seal होता है, who gives the call, like they bark, and that you heard that bark of the seal, that is Spongia cough. ड्रोसेरा में एक्चुअली कुत्ता खांसी होती है. It's a different thing. I just remember one clinical tip which I will share with you. If you get a patient of a barking cough, not responding to any medicine, normal common medicine, ड्रोसेरा दिया, स्पॉन्जिया दिया, हिपार दिया, ये दिया, वो कुछ काम नहीं आ रहा है. And with lot of painful, with congestion of the face, आंख में से पानी भी आ रहा है उसको, with cough, belladonna 3x. Potency is important. Belladonna 3x. Or if you don't have 3x, give in low potency, 6 or something. Now again come to the cough. Now Hepar sulf, also one of the great remedy for croupy cough, but it is more in the morning time. Spongia after midnight, aconite before midnight, and Hepar early morning cough with lot of throat symptoms and hoarseness of voice. The sore throat and hoarseness of voice. Croupy cough in Hepar sulf. Another drug comes close to Hepar sulf in this dry cough with hoarseness of voice is causticum. Causticum is a causation, exposure to dry cold wind, aggravation in clear fine weather, better in damp weather, lot of soreness of the throat, and this soreness and this dry cough better by drinking cold water under 9. Now see spongia patient, not better by cold. Hepar patient, not better by cold. But causticum patient is a hoarseness of voice also. The sore throat, which is better by, there's a cough, which is dry cough, which is better by drinking sips of cold water. And another characteristic of causticum, cough with involuntary passage of urine. The cough is so severe, it increases the abdominal pressure and patient passes the urine. Now, this is more common in female because of prolapse of uterus. CPI is also having similar symptoms, that involuntary urination while coughing and sneezing. Now, causticum, this is one of the very important symptoms. Two things, better by sips of cold water and there's involuntary urination. And with hoarseness of voice. Aggravation, clear fine weather, better in damp weather. Another characteristic of causticum cough, while coughing, they get pain in hip joints. While coughing, they get pain in hip joint. Here it comes very close to capsicum. Pain in distant part in capsicum. Now we go to a $1 million winter cough remedy, which is one of the greatest remedy for winter cough, is Mentha pipreta. Mentha pipreta. In Mentha pipreta, cough because of exposure to smoke. Now, this smoke could be because of pollution, or some trees are burned, which is very common in Delhi. परांदी जलाते हैं ना पंजाब में, because of that full Delhi is become polluted and everyone start coughing. Mentha pipreta is the drug. So cough aggravation from fog, cough aggravation from smoke, from pollution. Even patient is very sensitive to smoke of tobacco. And the characteristic of the cough, there's a dry, irritating cough with husky voice. Now see, it comes very close to causticum. But in causticum, these causes are not there. In causticum, this is not there. There was pollution, which is very common in India or anywhere if you go, whichever country, the pollution is very high. And normally in a very cold country or very cold place, they, to make the room warm, they use wood. They burn the wood, and the smoke of wood, which aggravate the cough. Mentha pipreta is the drug. Mentha pipreta, try irritating cough with husky voice, or sometime it become voice become hoarse. Give 30. Mentha pipreta 30 repeated. According to Clark, if you read Mentha pipreta from Clark, he mentioned that what arnica is for injury. What arnica is for injury. Aconite is for tension and inflammation, first stage of inflammation. Mentha pipreta is for winter dry cough. He had mentioned that every homeopath should remember this. I'm again repeating. What arnica is for injury, aconite is for inflammation and tension, mentha pipreta is for winter cough. Now in winter, when the temperature is very low and the foggy ban jata hai, fog, and if the patient develop cough from fog, they are exposed to fog, a pure fog and not a smoke. Smoke means it is with pollution. It's a pure fog, and if gets the cough, sepia is the remedy. Sepia is the remedy. And to your surprise, in sepia, there is an aggravation from fog or cough from fog. If you see Kent repertory, and if you see this rubric, cough from fog, only one remedy, that is sepia. Now, sepia, normally we think of only female reproductive system. But sepia has great affinity for respiratory system. The characteristic of sepia cough or sepia respiratory system, ascending cold, means the cold starts from the throat. The first the throat become bad and then the nose. So similar symptoms is also there in bromium. But the difference between bromium and sepia, bromium is a hot patient, halogen, no? All halogens are hot. Bromium is a hot patient, summer aggravation, while sepia, winter aggravation. Aggravation in the fog. Fog summer में तो होता नहीं. Sepia is a chilly patient. Understood? गला खराब होएगा फिर सर्दी होगा. That is ascending cold. Even Hipar also somewhat very good drug for ascending cold. But again, Hipar has some other symptoms. Now, what happens if there is snowfall and patient develop respiratory problem, cough, cold, aggravation from snow? In the respiratory problem from the snow, two very important remedy. Again, sepia. Again, sepia. So sepia, not only aggravation from fog, but also from exposure to snow or a snowy air. And second remedy, conayam. Conayam. Normally, we think conayam only for the suppressed sexual desire and the old people and some vertigo. But also, conayam has also a lot of cough and respiratory problem. Now, what happened in conayam from snow, exposure to snow? There is a, they develop cough with, there is a sensation of dryness in the throat. Now, रूमेक्स मैंने पढ़ाया था आपको याद. I said tickling sensation in the throat. Conam has a dry spot, with the dry spot causing the cough. In spongia, there is a full dryness. Full throat is dry. In conam, there is a dry spot. This is all fine tuning I am teaching you. Cough, aggravation lying down. Cough, aggravation lying down. Patient has to sit up. It comes very close to Drosera conam. Cough during pregnancy. Cough during pregnancy. And also one more thing they develop because of exposure to snow. Vertigo because of ear problem, labyrinthitis. Viral, after exposure to cold, they develop viral labyrinthitis which causing vertigo, which is aggravation lying down, aggravation turning the head to the left side. Now you must be that, suppose patient instead of left side, if he turns the head to the right side, he gets vertigo. Conam will work, but not as good as left side. So instead of conam, when the patient says vertigo on right side, turning that to the right side, instead of conam, you have to give muriatic acid. Now, another use of conam in respiratory, also one of the great remedy for a post-viral cough. Post-viral cough or a पोस्ट इन्फ्लुएंजा के बाद होएगा, और देयर मे बी एक्सेसिव वीकनेस, or it can be used as a tonic after post-viral cough. Post-viral, when you find a weakness, you can use Conam as a tonic. If you read Boric, it mentioned Conam can be used as a tonic after grippe. Grippe means viral infection. Now, snow se sepia and Conam. Now, if you get many a time when you're exposed to a very snowy air, snowy, windy, chilled wind air, snowy air, and if you develop rashes, articular rashes, give Urtica urine is the drug, which is very common when you're exposed to children, you get hives. Urtica urine is the drug. Many a time when you are exposed to snow, where there is a lot of thunder and all these things, patient develop a lot of joint pains, rheumatism. The, I use very frequently rhododendron. And when the snow starts melting, when the snow starts melting, and patient develops certain joint pains or some other complaint, Calcarea phos and Kali bichrome. Calcarea phos and Kali bichrome. Derivation from melting snow. I mean, in fog, there is one more remedy very useful is Jalsemium. Now, in Jalsemium, when patient is exposed to foggy weather, they develop fever. It's lot of drowsiness, dullness, thirstlessness. Means, and asthma from foggy weather, hypericum. Asthma from foggy weather, hypericum. Fever from viral, the winter virus जो बोलते हैं ना, one of the jalsemem is one of the very important remedy for winter virus, especially when they're exposed to fog. Now jalsemem in the fever, pain, chills runs up and down on the spinal cord. Dullness, drowsiness, thirstlessness, headache, which is better by profuse urination, with lot of anxiety. Now, Mansi. Hello,
Yes,
Mansi.
sir. Yes, sir.
Should I continue or?
Sir, if you want to, of course you can, because the session is really interesting, and I hope all the attendees are enjoying this session.
Okay. I finished with respiratory thing.
Okay. Okay, sir.
Now we come to skin problem, which is also very, very common in winter because of dry climate. There's a lot of dryness. The skin become very, very dry. The skin become dry, and sometimes It become cracked. The tip of the finger become cracked. Lips become cracked. They develop cold sore, that is herpes simplex. The important remedy for winter problem, especially skin problem. If you find there's an excessive dryness all over the body, alumina is the drug. Excessive dryness all over the body. In alumina, there's a lot of itching is there, a lot of pruritus is there, but not no crack. Patient say, how much amount of moisturizer I apply? Nothing helps me. My skin is very, very dry. Give alumina 30. And if you get a history of aluminum poisoning, means people who are using aluminum vessel for their day-to-day cooking, then it works much, much better. With constipation, soft stool require a lot of straining, potato disagree, but in the skin there is excessive dryness. Another drug comes very close to alumina in dryness, but it is localized dryness. Especially of palms and also soles, with lot of itching in the soles. I had seen very good result with hydrocotyle. Again, it works very well in lower potency 30. It is a great remedy for palmar and plantar psoriasis. Palmar and plantar psoriasis. If you get a patient with lot of peeling of skin, chopping, not a psoriatic patient, also even psoriatic patient also, but if you find out some patient, when the winter starts, their palm started peeling the skin. Yes, a excessive peeling on skin of the palms or even soles. But otherwise, there is not much of dryness, only palms and soles, and there is excessive chopping of the skin, peeling of the skin. We have one wonderful remedy, Kali Sulf. Kali Sulf 6X. In biochemic, it works very well. Or if you don't have biochemic, then 30. Now fine tuning between hydrocotyle and Kali Sulf. In hydrocotyle, there's a dryness. There may be some scaling. But here there's a total peeling of the skin. That is Kali Sulf. Another drug comes very, very close to hydrocotyle is melendrinum. Melendrinum. I use very frequently in my practice. I always differentiate hydrocotyle and melenterim. The difference between hydrocotyle and melenterim, in melenterim, dry ragates and there are deep cracks in the soles. If you remember, there was one advertise is to come. अभी भी आती होगी शायद. There is one ointment Kailash Jivan. The byline of that advertisement, Muse Maharani. On the face, she is a Maharani type. Very beautiful and very good looking. Maharani. Muse Maharani, पैरों से नौकरानी. And they had shown that legs, soles, which had all deep cracks all over the soles. Now, why does it nokrani? Because in Melantrium, exactly that is there. Because most of the nokranis or servant, they have to walk in the water, cold water. And when they are constantly, their feet are exposed to water and they develop cracks in winter or otherwise also, no other drug can come in give best result than Melantrium. Sometimes there's a crack, there's sometimes dry ragates, which is thick, blackish. I treated many cases of plantar psoriasis with melandium with these symptoms. It has also one more symptom, bad effect of vaccination. Bad effect of vaccination. When they develop all these problems after vaccination, think of melandium. Again, it works very well in 30th potency. Repeatedly. Now I'll teach you $1 million drug. If the cracks are very, very, very deep, as if the depth of the crack is so much, it looks the parts are going to separate हो जाएगा. It will fall out, just hanging. Very, very deep crack. Maybe half a centimeter, 1 centimeter. More the deeper crack on the palms or on the soles. We have one drug. See, if you give melantrium, it gives partial relief. There is a drug known as X-ray. X-ray 30 can bring back or heal all the cracks. Hydrocotyle, dry, scaly eruptions in the palm and plant soles. Kali surf, there is excessive peeling of the skin. Melantrium, similar like hydrocotyle, but still more deeper, more severity with dry ragates and deep cracks. Aggravation from walking in cold water, aggravation in winter, bad effect of vaccination, melantrium. And X-ray, very, very deep crack. As if the parts are going to separate it. They're just hanging. Nitric acid also good drug for cracks. But in nitric acid, there's a bleeding will be there. Bleeds on touch or there's a blood comes out from the crack with splinter-like pain. Continuous partial splinter-like pain on touching. In nitric acid also splinter-like pain with bleeds on touch. When you touch, it bleeds and gives the splinter-like pain. Sorry, while in Hepar sulfate, it's a continuous splinter-like pain. In Ipasar, there is a continuous splinter-like pain. In nitric acid, when you touch, there is splinter-like pain. When you touch, there is a blood. All this aggravation in the winter, especially in the tip of the fingers and toes. Two more drugs comes close to nitric acid, petroleum and agaricus. Sorry, petroleum and graphitis. Petroleum and graphitis. In petroleum also there is a deep cracks are there with thin, watery, sticky discharge. Aggravation in cold weather, aggravation in winter. Thin, watery, sticky discharge. Transparent sticky discharge. While graphitis, thick, yellowish, honey-like sticky discharge. Thick, yellowish, sticky, honey-like discharge. And if you get crack or dry skin in, this is very common in winter, but if you get in summer, cracks in summer, then you have to give sarsaparilla. In sarsaparilla, there is a summer aggravation. Then cold sores or herpes simplex, which occurs in the lips, or lips become crack also. The lips are cracked. Natrum mur is one of the very important drug. Another important drug is a deep crack in the lips, especially lower lips, condurango. Condurango. Condurango is a plant which is very useful for the treatment of stomach. It's an anti-cancerous plant. But also useful for deep cracks or cold sores. It's herpes simplex. And if it is the corner of the mouth, corner of the lips, here and here, if it is bleeding, give nitric acid. If it is with the blood and infection, pus also is there. Some infected here now. Give Merck salt. And there is no bleeding, only crack, herpes simplex. I had seen best result with antimony crudum. I had seen best result with antimony crudum. Now the neuralgias in winter, which is very common when we are exposed to a cold, windy air, Bell's palsy. The great remedy is belladonna, causticum. Many times the trigeminal neuralgia aggravates in winter. The pain aggravates. Whenever the neuralgic pain comes, we think of McFoss. But if there is an aggravation in winter, cold, patient is sensitive to cold, for trigeminal neuralgia or any other neuralgia on the face, magnesium carb is the drug. Another important remedy for neuralgia, mesothelium and verbescum. Causticum. Causticum is a lot of more than the pain, there is a paralysis, facial palsy. Verbescum is great remedy. Left-sided neuralgia, trigeminal neuralgia. Agaricus also a lot of neuralgic problem, especially in the lower extremity or in the upper extremity also when there is sensation as if thousands of cold needles are pricking. Agaricus also a great remedy of frostbite. Now, from the when you're exposed to the snow, when you're gone for a trek, or you are stuck up in the snow and some snow went inside your shoes and you develop frostbite. Agaricus is one of the greatest remedy. Three remedy for frostbite: agaricus, petroleum, and abrotinum. In abrotinum, there is a lot of itching in chilblains, that is frostbite. A lot of itching is there. In agaricus, there is a cold pricking sensation. There's a thousands of cold needles are prick. And in petroleum, there's a discharge is there, which I already described. Now, joint pain, I already told you, calibi, calcaraphos, calicab, rhododendron. Now, if you get a patient, now what happened in winter, the weather become very gloomy. Especially go to the UK side, London side, when the sunset takes place at 3 o'clock. Very, very chills. Full dark ho jata hai sab. And there's some sadness, gloominess in the environment. And patient himself also patient feeling lot of sadness or depression in winter season. Ammonium carb is the ammonium carb. I almost cover all the common winter problem. I hope you had understood my lecture, because I want to make you everyone Sachin Tendulkar. And in the starting of the lecture, as I told you, and I promised you that होम्योपैथी दिल में भी रहेगी, समझ में भी रहे आएगी और रिजल्ट भी लाएगी. As you know, एक बार मैं कमिटमेंट कर लेता हूं, उसके बाद तो मैं अपने आप की भी नहीं सुनता हूं. दुआ में याद रखना.
Yes, sir. So I was saying that this session was really very informative, and I hope this session will help a lot of our homeopaths in their practice and their in their knowledge of materia medica. Session was really helpful. First of all, a great thanks to you for sharing your knowledge. And now it's my request to all the attendees, if they want to ask any questions, they can put their questions in the chat box in question answer option, and we will have a short question answer session with us. Like Dr. Dhirendra Kumar has asked, for osteoporosis, which medicine should be applied? Cough is productive continuously.
Again, you repeat the question.
For osteoporosis, which medicine should be applied? Cough is productive continuously. Continually is the cough. I mean, he want to say that cough is productive.
Okay. Blame is there now. See, for osteoporosis, after seeing patient's diet and everything, if required, change the diet, and along with your indicated medicine, you give biochemic calcera floor 12x and calcaraphos 12x. But if the osteoporosis is very severe, then you have to give supplement. But many times what happens, patient is taking supplement, but still it is not improving. You add this biochemical remedy, it gives very good result. Now,
Okay.
question of productive cough. See, with the productive cough, one of the great remedy in winter specifically, again, Hiparsulf.
Yes.
But if the patient is hot and having a productive cough like Hiparsulf, instead of Hiparsulf, give calcarea sulf. Similar symptoms like hepar, there's a productive cough, yellowish cough, but patient is hot patient, तो hepar सर्व काम नहीं आएगा. You have to give careless सर्व. And if all indicated remedy fails in productive cough, give few doses of tuberculinum aviaria.
Okay. Thank you so much, sir. Next, Alifia has asked excessive dryness in hands during winters. If you touch your skin, all surface feels very rough. Please tell me the remedy, sir.
Yeah, I already told excessive dryness only in palms,
Hmm.
hydrocotyle. It gives the best result. If hydrocotyle is not helping the patient, then you can give alumina, which is more deeper acting. But normally I give alumina when there's excessive dryness everywhere. But excessive dryness in palms, the first choice, I put my money on hydrocotyle. Hydrocotyle 30 repeatedly. And again, I already told the Kali sulf also comes very close, but in Kali sulf there is a lot of peeling of skin. Hydrocotyle में itching भी बहुत होती है. ऐसा they feel like scratching the palms. Next.
Yes, we have three similar questions regarding dryness. Like Samina has asked, sir, cracks throughout the ear.
Where but?
She said cracks throughout the ear. I mean, she's trying to say whether it is winter or summer, cracks are there on the skin. Which
Again, melanthrinum is the drug.
and yes, as you have said, it's for deep.
Yes. Melanthrinum is the drug. See
And
that cold weather precipitated aggravate, maybe a exposure to water is also aggravated. Otherwise, melanthrinum gives best result.
best room. Yes, so
And
we
you
have
can also give intercurrent as a syphilinum, few doses of syphilis.
syphilis. Yes.
And if the nails are also involved, there's a along with the crack, there is a nails, there's a vertical ridges are there. Then give fluoric acid.
Okay. Dr. Singhal has asked if dryness is symmetrical in both lower limb, and after that, Alifia has again asked face dryness during winters. I think the drug
I again say alumina.
alumina dryness for dryness.
And first, what Dr. Singhal said? Yes.
Dr. Singhal has asked if dryness is symmetrical in both lower limb.
Now, if you're not improving the indicated medicine, give syphilinum few doses because syphilinum 200 or 1 few doses because syphilinum is one of the very peculiar symptoms, bilateral symmetrical.
Okay, so after that, Mihir has asked, sir, kindly suggest remedy for severe shivering type symptom in winters.
Now, here, when a patient gets a lot of chills or coldness, even you can think of drug like pulsatilla.
Okay.
And then I already told you, when there's a lot of coldness, sisters, heloderma.
Hello, down.
And first you rule out why shivering is there. कुछ body में infection है क्या है वो देखना पड़ता है.
Yes, sir.
And all these remedies not helping. So we have one very good remedy, a nosor sorinum. Give few doses of sorinum, 1 ml.
Yes, sir.
Any more question?
Yes, sir. Shreya has asked, sir, winter me Bell's palsy. I mean, she want to ask drug for Bell's palsy in winter.
No, the Bell's palsy, one of the great remedies, causticum. If it is on right side. Left side, you can think of drug like belladonna, verbascum, even spigelium.
Okay.
Aconite also many people give because that basically Bell's palsy occur because of exposure to dry cold wind, chilled wind. And one more drug, you can use it in a mother tincture form also, and along with the indicated remedy, Scutularia mother tincture.
Scooter.
Scutularia or skull cap. The common name is skull cap.
Okay. Okay, sir. Next, Dr. Naeem asked, spasmodic cough with scanty sputum in winters and patient is desperate for recovery. Which medicine, sir?
Desperate for?
Desperate for recovery.
The spasmodic cough, the first choice of drug, I always put money on Cuprum metallicum.
Cuprum, yes, sir.
Start with 30.
And sir, as we discussed about the aggravation on smoke, one attendee has asked, Malathi has asked, in case of forest fire or bushfire, after that, lot of air pollution with smoke, particles, and gas is there. What remedies to be thought of respiratory issues?
Entapipreta.
Yeah. Okay, sir.
See, I use very frequently Entapipreta.
Mentha pipreta. Yes, sir. You have
People was having that
discussed it.
north side, no, Delhi side.
Okay, sir. Rupam has asked remedy for camphor-like coldness sensation in knees.
Sensation is
Remedy for camphor-like coldness sensation in knees.
see that no, you have to see the repertory.
Yes, for that particular location, you have to
Like
see repertory.
camphor like cold, already sisters is there, no?
Yes, sir. Straighta, you have said. Dr. Anil Sharma has said, sir, please suggest best remedies for chilblains in fingers.
No, but your chilblains also, no, you have to ask the symptoms.
Yes, sir.
The chilblains is with itching, abrotinum. If there is a sensation of needles, then agaricus. Mostly agaricus अच्छा काम करती है.
Yes, in agaricus, there is a clear-cut indication for chilblains. Next, Astha Saxena has asked, sir, every winter there is itching in lower limbs. First itch, after that spots of bleeding occur. Which remedy to think?
Now, if it is bleeding occur, then nitric acid is the drug.
Nitric
No
acid.
bleeding, then hydrocodone.
Okay, sir. Okay, so many attendees have joined and they have started questions.
Again, your voice become very low.
Okay, so if the attendees are still there, yes, we have. I have created a small quiz from today's session. So if they are interested, they can put answer of these questions, and these questions are from the session only. Okay, so if the attendees are still there, yes. So sir has discussed a trio of croupy cuff. So if any one of you remember the answer, please write your answer. Let's see how many of you got this. Okay, we have started receiving answers. And the first one is Dr. Mayank Patidar. He said Aconite, Spongia, and Hippar. Absolutely right. We have lot of correct answers from Shanti, Astha, Pooja, Janvi, Shefa Khan, Rajat, Archana, Mahesh, Hina, and Dr. Singhal. Very nice. Okay. Also, next question. Dr. Shukla sir has said he mentioned two remedies for different sinusitis, like one for winter and another for summer sinusitis. So, which two remedies are for these weathers? Do you remember? Let's see who's the first. Okay, so Astha Saxena has said Kali broom and hydrastis. But which remedy for which weather? Zoish Patel has said hydrastis for winter and Kali Bai for summer. Is it
Yes.
correct? Is it correct?
Yes. Yes.
Yes. Shivam Gupta, Shefa Khan, many people have said it's correct. Okay, Dr. Shukla sir, we have learned remedies for asthma aggravated on dust. Do you remember few remedies? Asthma aggravated from dust. We have learned numerous remedies. Exactly. Vasant Kumar, Pothos, Janvi Yadav, Shivam Gupta, Hina, Rajat, Shiv, Nishant. Absolutely correct. And one remedy is very close to Hipar sulf. Sir has taught us that Hipar sulf is for sore throat. But one another remedy, I think it's new for us. So we learned a new remedy today, which is very similar to Hipar sulf. Yes, it's sisters. Very nice. So you can see
Yes. Yes.
you can see how many students and physicians has said correct answers, and it's very impressive.
Good. They are going to become Sachin Tendulkar.
Yeah, yes, sir, sure. No, we really learned today. Anybody remember the drug for laryngitis in which sir has explained he explains about the vocal cords that patient want to clear his throat before speaking. Yes, exactly. Very quick answers and correct answers from Nishantak, Shia, Shefa Khan, that is Argentum metallicum, he said. Yes. Janvi Yadav, Prashant Sail, Shruti Gaur. Very nice. Okay, sir, I think it's time to wrap up. It's getting late. And thank you so much for your time. Thank you so much to share your knowledge with us. We are very grateful today, and we learned a lot. Thank you so much, sir.
Thank you, Mansi. And I would like to tell something to all the listeners. Please follow my Insta page, Dr. Nimesh Shukla, which I'm taking some power of five, Homeopathy simplified, with smart Matra Medica, sometime Matra Medica, sometime clinical tips. Do
Yes.
follow my Insta page and recommend to other also. Thank you very much.
Thank you so much, sir.